So this is not going to be as pessimistic talk. We have some optimism. So essentially, we recently established one cancer hospital in Nepal. So what are the lessons we learned? Everybody talks about global oncology. What are the issues? How many of you know, have you heard of Nepal? How many of you? Can you raise your hands? Great, excellent. Now, do you know which continent it is located in? Asia, Africa, Latin Asia? Great, oh my goodness, I can't believe. So it is surrounded by China and India, as you can see. It is one of the least developed countries in the world. And almost 25% of the population lives under poverty line. Now, GDP is $2,700, and 30% of GDP comes from remittance. Now, Nepal has 7 states. Unfortunately, all the cancer centers were here in one state. Can anybody guess why would that be?
That's where the capital is?
That is correct. So if you go to Nepal, that's where the capital city is, right? So, and everybody says, oh my goodness, Nepal is so poor. Let's establish one cancer center here. And then another, China goes there, like, oh, Nepal is really poor. Let's establish another cancer center here. so as a result, there are numerous cancer centers in this state. And there were no cancer centers in the entire country. Geographic disparities that we talk about, right? So this is the Google map. If you look at the cancer center, if you type cancer center Nepal, all right, you will see a bunch of them in one state. This is a cancer center we established in another state, in this one. So this is the second most populated state in the country with 5.5 million people, and the other province had 6 million people. So it is most densely populated. It is small geographically, but it is too many people, 5.5 million people. Again, it is culturally very different compared to the rest of the Nepal. Different language, poverty, and they would have to drive 8 hours to get to the nearest cancer center in the country. So based on my informal conversation with other colleagues, almost 40% of the patients who go to other cancer centers, they come from this state. These are the common cancers: head and neck cancer, cervical cancer, breast cancer, liver cancer, and colon cancer. So we said, well, we should have cancer center there. So a city there, they requested us to help them establish cancer center. We're like excited. We're like, well, why not? Let's do that. So we have this sister organization of BTF in Nepal. So we signed kind of trilateral MOU, and the city agreed to provide land for construction and contribute part of the cost of building the hospital. So we hired one MDGP, who started palliative care and a screening program in August of last year. But then there was a dramatic conflict among elected officials as to who would be head of that program from city. As a result, it failed. So question is, what do we do now? So we decided to move to another city close by, 10 kilometers from there. 10 kilometers is around 6 miles. Well, 6 miles sounds like 10 minutes drive here, right? It takes 1.5 hours over there. So we rented one 15,000 square foot building, which was designed to be for a hospital. And we obtained permits and started 25-bed hospital in December of last year. So chemotherapy started in January, ENT services. We bought X-ray machine, ultrasound machines, 2 of them. A lab that does CBC, CMP, tumor markers, and coags, and all that. 24-hour emergency services. And we also developed our own electronic health records. So it is fully computerized hospital, essentially. We established surgical services in April of 2019. We hired surgeon, anesthesiologist, Now we have ICU. This is how our OR looks like. So this is the actual patient who is receiving surgery. Tumor board, so we have virtual tumor board once a week on Sundays, and it is attended by doctors in Nepal, here, as well as in India. And it is 7:15 a.m. on Sundays. So if any of you want to be part of that, let me know. I know some of you attend that meeting from here. So this is how it looked like. Essentially, they show the pictures and slides and X-rays, and we talk and converse. And Dr. Kevin Knopf, are you here still? No. It's such a beautiful weather outside. He can't be here. So he's from San Francisco, and he joins us on a regular basis. Yusuf joins us, and a few other docs here. So what are our major challenges? So first of all, it is a big need. This is the only cancer hospital for 15 to 20 million people, not only for Nepal, but also in India. As you know, India is a vast country, more than 1 billion people. And most of the cancer centers are located in Delhi and Mumbai, right, Arvind? If you go to Bihar, which has 100 million population, hardly has any cancer center. There are a couple of them, and that's it. So this is the only cancer center that caters to large part of the Bihar, the state of India, as well as multiple states in Nepal. Funding is another major challenge we have. Trained healthcare professionals, and of course, corruption. Do you know that the United States is not the cleanest country, right? But this one is worse than, Nepal is worse than the United States, by the way. So in 1990s, Nepal became multi-party democracy. It was a monarchy in the past, right? It was king and queen and whatnot, right? So instantly, enormous amount of money came in the country in healthcare, in economy, the education, and whatnot. You would think with billions of dollars poured in, it would have become a developed country. But then it still remains one of the poorest countries in the world, with a large number of people still surviving on $2 a day. Now, in a country like the United States, where if you don't have health insurance, you go bankrupt if you get cancer. Imagine what would happen to these people, right? So that is a huge deal, big challenge. I just got it from Transparency International, and Nepal is 124th most corrupt country in the world, all right, out of 180 countries. US is, I think, in 30 or 40, something like that. It is not in top 10, by the way. But it is not 124th. So we found there was a hurdle in every single step. So our sister organization was being registered, and every single individual from clerk to everybody wanted, okay, how about you give me $10 or $20 for us to sign this paper, all right? And that's how the world is in South Asia, correct, Arvind? India, same thing. So the question should be, okay, I understand that you are establishing a cancer hospital, but how will I benefit? All right, so essentially, while we think that nonprofit is a simple concept, it was not as simple to convince them what nonprofit would be. So funding needs. I just read the news, City of Hope is investing $1 billion, $1,000 million in establishing one cancer hospital. All right, they're building a brand new building. We need $10 million to help provide cancer care to almost 15 to 20 million people. But nobody's willing to invest that kind of money there, even though it can help large number of people. So equipment, as you know, radiation oncology costs $3 million. Very costly, very hard to get. And on top of that, government of Nepal has decided that they would not accept any used equipment or refurbished equipment. If somebody wants to donate, it has to be brand new. And the reason being, in the past, they would allow everything. And some of the hospitals, what they did was, if their machine broke, they would donate it to one of those hospitals. So now you have a CT scan machine sitting outside. It does not work. All right? And here you have the big press. You're like, we donated the $1 million worth of equipment to this country or that country, right? Or this hospital. We expect it is going to help this many thousands of people. And then over there, those people are trying to figure out how to dump that product now, what to do with that, right? So they would be spending a lot of money, their own money, to dispose that equipment, which was donated to them. As a result, the government of Nepal decided that they would not accept anything that is used or refurbished. They need everything new. So as a result, the entire project becomes super expensive. If you want to buy a CT scan, $500,000. Radiation oncology machine, $3 million, right? So having said that, we have found partners. America Nepal Medical Foundation, they are supporting part of the project. One of the medical schools in Nepal, they help us with pathology. So we do not have our own pathology. So we do biopsy or we do surgery, send it to this med school, and they do all those tests. And I know there are a number of other organizations here who have been supporting us. They're working on towards that. So this is when we start the inauguration of this hospital in December. This was our first patient who received surgery. This man, it is interesting, 70-something-year-old man. I saw him, in fact. So he went to Kathmandu and got this biopsy done and everything, and he had bad, significant back pain. And everybody is like, okay. Everybody knew he has cancer, prostate cancer. They're like, oh, no, you have just arthritis. We'll give you a shot. So they gave him Lupron shot. All right. So the person comes to me, and we talk, and I'm like, well, you have two options. You have cancer, and the guy started crying. Do I really have cancer? I'm like, yes, you do. So then I explained to them, even though you have cancer, it can be treated, and you may survive for a long, long, long time. So one option would be to receive that shot, or you can even opt for orchiectomy. And he decided to go for orchiectomy, and we did that. And he's receiving now surveillance at the hospital. And he was very upset that nobody ever told me that he had cancer and was giving me shots for cancer. This is how the hospital looks like if you go inside. This is how our clinic looks like. He is one of our physicians, MDGP, outstanding person. He does a fantastic job. This is how our electronic medical record looks like. So this is, we hired 2 or 3 IT folks. And as you know, it costs hundreds of millions of dollars, or $20 or $50 million to install EMR in our hospitals here. We built this for $5,000. As you can see, we can have diagnosis, imaging, lab, medications, allergies, physician note, nursing note. You can upload documents, vitals, and you can enter the orders. Very basic, but it has all those critical components that you need. We also do screening in community. So for example, this is one of the health camp where these local women, they come there, and we have a couple of doctors who go there and do cervical cancer screening and breast cancer screening. Because every single patient who came to our center with breast cancer had a stage 4 disease. But these women would not come to us unless they had fungating mass, because there are a lot of the cultural issues, as you can imagine, right? So recently, just a few days ago, they had one health camp. They found 3 patients with breast cancer and 3 with questionable cervical cancer. Same. This is the health camp. So we are looking at establishing a breast cancer program. One of the physicians from Mayo Clinic is working on this project, and we are hoping to have a good quality, strong breast cancer program there. One of our doctors from SCCA, Dr. Andrew Kwan, he's working on establishing hematologic malignancy program. So we plan to have flow cytometry and everything, and we are sending one of the doctors to train in hematologic malignancies for 1 year. So we will have a robust hematologic malignancy program. We also plan to establish our own stem cell transplant program by 2021. And in fact, we are going really, really fast, and it's very doable. Within 6 months, we have been able to do all these things, and we see no reason why we can't have our own stem cell transplant program by 2021. We are hoping to have a radiation oncology program by the end of next year. And we are also discussing with local university to start medical oncology fellowship training. We have, right now, we are working on partnership with major institutions, including Harvard, Mayo Clinic, UPenn, and different places, and they are very interested. I know there will be at least 3 or 4 oncology fellows who will be traveling to Janakpur starting January of next year as part of their oncology fellowship program, and they will be spending 1 month each. And on top of that, we have a number of cancer doctors from all over the country who are traveling next year. So despite the challenges, establishment of this kind of major healthcare project infrastructure is feasible. It requires partnership with individuals and organizations that share the same vision. You don't want to go with individuals who want a cut. You see what I'm saying? Yeah, that really sets you to the failure. Every dollar goes a long way. So as I said, $1 billion institution, cancer center in LA by City of Hope. In LA you have numerous institutions, right? Here, $10 million is going to help 15 to 20 million people. Enormous impact. It is critical to improve access to care in these people, specifically now that non-communicable diseases have become so prevalent. Infections are not the commonest cause of death in low-income countries. They are cancers and heart diseases. I'm confident my colleagues who came originally from low-income countries, they know this now. So, for example, Tina, she's one of our nurses. She's traveling, she's an outstanding nurse, chemotherapy nurse, and she's traveling to the same center this August. We have 2 other nurses traveling there in October, 1 in November. Linda from Spokane, she's traveling there in March. And we have a major conference coming up there, and I know there are 6 or 7 doctors from different institutions in the United States traveling for this conference. We have a bunch of docs from India who are traveling there, so we expect around 200 doctors to be at the conference. If you want to volunteer, want to join us, contact me. Thank you.